Hey guys, this is your medical advisor, Dr. Sam. Now in this video, I'm going to be talking about a big elephant in the room, which is all about a medication called duloxetine, aka Prilogy. You might have wondered, is Prilogy safe? What are the side effects of Prilogy? And is it effective? Does it work? In this video, I'm going to be explaining all about those questions, plus some of my personal top tips. So stay tuned. The reason I decided to make this video is because there's not a lot of good information out there about duloxetine, and I'd like to give you the latest medical evidence about Prilogy so that you can decide if this medication is right for you. Now let's get down to the nitty-gritty. What is premature ejaculation? Well, it's a major deal in male sexual health. It affects 20 to 40% of all men.
Oh my God, I can't believe it!
I know, right? So what is it? It's the inability to control ejaculation, which occurs with nearly always or always within 1 minute of penetration. This causes low self-esteem, embarrassment, and relationship problems. There are two main types of PE. One where it's lifelong, i.e. it's happened all a person's life, and the cause tends to be neurobiological, i.e. a brain cause. The second type is acquired, where it only happened later in a person's life, and the reasons are usually psychological and neurobiological causes. So what are the current treatments for PE? Well, there are lots of behavioural techniques which have been recommended, like the stop squeeze technique and using local numbing anaesthetic agents. However, the long-term results of these have shown no benefit. There's also been studies looking at whether medications like Viagra help with PE, and again the results of these trials have been very mixed, so it's generally not recommended. I can hear you asking, well, what is there then? Well, there is Prilogy. Several years ago, they were doing studies on SSRI medications, which is a class of medicine used to treat depression, and they noticed as a side effect that people who were taking these medicines had a delayed ejaculation time. As a result, duloxetine was specifically designed for PE, where it's got a lot of advantages over the other classes of SSRI medications, in that it is rapidly absorbed by the body, and it rapidly goes out of your body after about 1.5 hours of taking it, which means you can use it on demand. So how do you take Prilogy? Well, they come as tablets, and you take one 30 milligram tablet 1 to 3 hours before sex, and you can take it with or without food. What are the side effects of Prilogy? The most common side effects are nausea, dizziness, headache, and diarrhea. You can try and take the tablets with food to help with the nausea. Does duloxetine work? Is it effective? Yes, in multiple different studies looking at quite a few different outcomes, Prilogy was shown to be very effective at helping treat premature ejaculation. Now your next question is the big one. Is Prilogy safe? So there are a few things to consider with this question. Firstly, it's been shown in studies that there's a higher risk of fainting when taking duloxetine, but there are no long-term heart problems associated with it. Other really important things are it interacts with quite a few different medications. So if you're taking meclobamide, itraconazole, paroxetine, you can't take Prilogy. It's best to check with your own doctor and pharmacist to make sure that it's safe for you. Is there anyone who can't take Prilogy? For people who have significant heart disease, a history of bipolar disorder or severe depression, this medication isn't suitable, and that's mostly to do with the fact that it's a SSRI medicine, so it can interact with lots of other medications that you might be taking. Other things I should mention are the biggest barrier, I think, for taking Prilogy or duloxetine is the cost. I'm from New Zealand and we prescribe it here, but it's not available in every country, and it is very expensive. So for about 3 tablets it costs $80. But I feel for people where it's been a lifelong problem, it is worth just trying the medicine to see if it helps you, and if not, you're no worse off than currently. I hope you've enjoyed this video and found it helpful. If you did, please remember to subscribe, and you can also hit the little notification bell next to the subscribe button so that you don't miss out on any of our latest videos.